to RQIA and the work that's ongoing. Council members will be aware that RQIA visited the Trust between the dates of 12th of November 25 and the 19th of February 2026, and we then received a report on the 28th of May. We look forward to continuing that engagement with RQIA over the next number of weeks to review our progress against the areas for improvement which they identified, which is part of normal process when they identify areas for improvement. So at that recent visit, they identified 4 areas. The first one was just around application of the pathways and ensuring that the Emergency General Surgical Service operates as a cohesive, coordinated and clearly defined service across all sites. Further work has gone on with respect to pathways and engagement with the internal teams, with an emergency department workshop in April and a clear set of pathways identified and stored within the emergency department. There are also another number of other pathways which Council will also be aware of with respect to repatriation and minor ops in Southwest Acute Hospital. As you'll know, Council members, the Trust regularly monitors the key data insights through its programme board chaired by the Chief Executive, which includes the direct-to-bed piece. As you'll know, previously we reported that direct-to-bed post our reset was at 97%. The ambulatory service has increased from 5.6 patients per day to 5.8 patients per day, and the number of patients transferred continues to average in the region of 2.5 patients per day. Just to say that the numbers of patients that don't go direct to a bed on a weekly basis is in the region of 1.6 patients. But if I can just update you in terms of some recent figures that came out just last night. From the 8th of May 25 to the 12th of July, 677 patients were transferred using the pathways. 17 of those 677 patients did not go direct to a bed. So it is a small proportion of patients now since our reset that don't go direct to a bed. And in the last 23 weeks, it's important for me to point out as well too that 100% of patients actually went direct to a bed. So we have continued to have oversight over that particular aspect of the pathway. Secondly, staff engagement and collaboration and team working and communication. This primarily related to relationships with Northern Ireland Ambulance Service and their crews and their booking teams. We had a very successful event in the Trust, which Geraldine and myself were both at, chaired by a member of RCC from the region, where we brought NIA's colleagues together, including paramedics, control staff and senior officers. And we had a very useful plan to move forward with respect to changes with direct to bed primarily. As a result of that, an action plan has been developed. Geraldine also has identified monies for the appointment of a HALO, which is a hospital ambulance liaison officer, which will again be that bridge in terms of communication between staff in the emergency department and in NIAS as well. Just to say, we've also extended the private ambulance provision to include an earlier start and a later finish in the evening, which again has contributed to the timely transfer of our patients from ED to a bed. The Trust has also undertaken a significant programme of engagement, which Teresa reflected on as well too with staff as part of that work. Also important to say in that work that timely transfer, the evidence clearly demonstrates that timely transfer is occurring through this work. Number 3 then was around a temporary pathways audit. Throughout the temporary change, we have continued to audit all patients who are transferred via the pathway. Cycle 3 of the audit has commenced in May. We've just completed the data collection and we are on target with what we told RQIA whenever they were with us, that we would continue the data gathering. We would complete that in July. We would begin the analysis in August, share that with Programme Board in September, and then be in a position to share that more widely with Trust Board and RQIA in October. So we are in line to do that. And needless to say as well, we've just had the national training survey from our junior doctors in recent days, which shows very good feedback with respect to the experience of our junior doctors who are in training in the Western Trust. The last piece then is around risk and incident management and strengthening that process. There is a clear process for review of incidents, as you'll know, through RRG and Corporate Safety Huddle. and a review of the corporate risk is now underway, following a workshop with Trust Board, presentation to corporate management team, and presentation then at Programme Board. We also present a thematical analysis of any issues to Governance Committee and Programme Board. And the Trust also has established a Learner for Improvement Forum to promote how learning is applied throughout the Trust. And this forum will review data sets presented by risk management, as well as learning from complaints, RQIA reviews, and patient safety incidents. So we have a very clear quality improvement plan in the Trust to take consideration of those 4 areas for improvement, and they will be brought to Programme Board on a monthly basis, chaired by the Chief Executive, and there is ongoing dialogue with RQIA with respect to these areas. Thank you. That completes my update.
Thank you,